Hello. In this video, we're going to be discussing chapters 16, 17, and 18. In chapter 16, we're discussing substance use and prevention across the lifespan. When we talk about prevention, we're talking about services that are apt to um, decrease the individual's possibility of using across different populations, across different marginalized areas, identifying kids, adults, older adults, right? Programs that are geared towards decreasing the ability that substance for substance abuse, adhering to education, providing coping strategies, providing strength building strategies within the communities for financial assistance, literacy programs, those type of programs that can enhance the abilities, individuals' ability to um, have efficient lifestyles and whatnot, which could decrease possibilities of substance use. So we want to tailor programs to be developmental stages, improve effectiveness, right? We want to make sure that we can develop each program to a point where we can measure its outcomes to see how those programs are effective, and they can also be improved to strengthen those programs and whatnot throughout its delivery. So key prevention strategies. We want to use universal preventions. So this is when we target entire populations. We can target everyone to make sure that those programs are geared towards decreasing the possibility of use. Selective prevention. When we're targeting at-risk populations, we're targeting at-risk groups, groups that are marginalized, groups that have a higher potential for substance use based off of certain dynamics. So we want to target those groups with selective preventions. Indicated preventions, targeting individuals that don't have early signs, individuals that have family history of substance abuse, or are coming from impoverished areas or areas where there's high rates of substance use, high rates of drug dealing, high rates of crime, high rates of pieces of environment that can increase the potential for individuals to have substance use. So when we talk about lifespan specific programs, we're talking about programs for children. When we talk about school-based education and parent training to actually equip parents with the skills or tools utilized to become effective parents, and school-based education programs where we identify the impacts of substance use and the barriers that substance abuse can create for our students. For adolescents, those young adults who are really geared towards and focused on um, peer pressure or being accepted or um, fitting into the communities that they're in or whatnot, providing mentorship, providing resistance skills, providing enhanced self-esteem programs and whatnot. Those programs that create higher self-worth for individuals who are, again, at a stage in time where they're trying to find themselves. Adults. So we want to have workplace programs because workplace stressors or workplace issues or whatnot can definitely impact someone's ability to cope with certain substances in areas. Talking about stress management. Talking about programs where we're helping people identify ways of dealing with stress. And then for older adults, we're talking about medication monitoring and social situations or what skills or whatnot to help older adults that are at advanced ages or whatnot to help them actually deal with the possible influence of substance use. In chapter 17, we're talking about cross-cultural counseling. So again, we want to use that emic approach, where emic approach is an approach that goes across cultures, right? That goes across cultures that help individuals to actually individualize care towards their individual cultural needs instead of having an etiquette approach, but those approaches that are go across cultures and whatnot. Etiquette approaches are I'm going to use this approach with every individual that I treat, no matter what circumstances are present, right? And also, we want to understand diverse backgrounds, right? Because understanding diverse backgrounds creates levels of empathy, creates an environment for the client to feel as if they are accepted, right? And their individual care is going to be individualized to meet their needs and understanding their backgrounds and their strengths. So to have culturally responsive practices, again, we want to use that emic approach where we adapt every intervention to the person's culture. and incorporating their cultural values and their traditions, right? And we want to continue to engage our clinicians in active self-assessment of their own biases and the situations in their belief systems. So barriers to engagement, right? Language differences can be a huge barrier to engagement. If the client can understand you or understand the information being provided to them or understand how to express themselves with you or whatnot, that can become a barrier of engagement, right? And mistrust of systems, right? Because again, we have to have systems where clients trust the systems. If they don't trust, it's hard for them to get to the higher order of thinking. Because we must remember, trust frees the brain for higher order thinking, right? So there has to be trust into the systems, right? So clients can actually think and actually obtain information that can help them within those systems. Stigma within communities. There's a lot of stigma about treatment within certain communities or whatnot. We want to strengthen clients' knowledge of treatment or whatnot, so they can eliminate some of that stigma and be able to deal with some of that stigma within their community. And lack of representation amongst providers. So again, part of what we want to do is be an advocate for our clients to help them actually have representation amongst other providers and other care networks and whatnot, so they can actually have that level of representation, so they can have a voice. So in chapter 18, we're talking about gender, sex, and addiction. So we're talking about that biological and psychological and social factors that influence substance use. There can be a difference between genders on how that is um, those influences are. So women may pay more, may have experience more rapid addiction progress because again, more women are more prone to actually seek out care and express themselves, discuss things that are emotional with them, things that can be triggering their use. Where men can be more prone towards not expressing themselves and internalizing things. So gender specific treatment needs. So women trauma informed care is going to be important, even though trauma informed care is going to be important for every client that we treat. We want to treat every client that we treat as if they've experienced trauma, making the environment trauma sensitive, right? Child care supports are very important, as a lot of our mothers can have deficits in child care, right? They can actually be in situations where some of their substance use have influenced loss of their children or loss of relationships with their children or whatnot. So providing a level of child care and support is important. Men, we want to address social norms and masculinity because again, a lot of times those things can be barriers to them actually engaging in treatment and getting the care that they need. Non-binary and transgender, we want to have informing environments of care that provide levels of care where clients feel as if they're heard and they're in an environment that's safe and an environment that can affirm that they can be who they are and not have there's no agendas or no influences. So we want to make sure that we can be neutral in that aspect so they can actually be who they are. Finally, when we talk about the LGBTQ community, right, there's a lot of population and stigma due to discrimination, which creates higher rates of use, right? Individuals not able to be themselves. They are happen to hide who they are or try to have to portray being someone else amongst their peers for acceptance or whatnot, which can lead to high rates of anxiety, depression, suicidal ideation, right? Which can all can be influences of use, right? So it's important that we create an inclusive environment and a safe treatment place, right? A safe environment for them to be themselves, to express themselves, and actually be able to come to a grips with being who they are and love who they want, and again have an environment that is conducive for them to express themselves and learn is so important and imperative in treatment and the reduction of substance use or recovery from substance use.